Welcome to the Medical Billing Blueprint podcast, where we break down the complexities of medical billing, revenue cycle management, and healthcare compliance. Join us as we explore strategies, tips, and industry insights to help doctors, practice managers, and medical staff optimize their billing processes and boost practice revenue. Let's get it right with the Billing Blueprint.
Okay, so imagine walking into your doctor's office, right? And instead of them being like glued to their computer screen, they're, totally focused on you. Like it's just the two of you in the room. Maybe that's the future that generative AI could bring to healthcare.
What's wild is we're not just talking about AI that analyzes stuff. This is AI that can actually create things, reports, summaries, maybe even diagnoses, which frees doctors up to actually be present with their patients.
It's almost like having a medical scribe, but one who's also like a total data whiz.
Exactly.
But before we get too far ahead of ourselves, can you break down what generative AI actually is? Like, how is it different from the AI we've been hearing about forever?
Sure. Think of it this way. Traditional AI is like a really good detective, analyzing clues, solving cases based on the evidence. Generative AI, it's more like a master storyteller. It takes what it knows and then creates something totally new, a poem, code, or in this case, those insights from medical data.
And we're not talking about some far-off thing either, right? This is already happening. There are companies that are already using this to help doctors with note-taking, which has got to be one of the most time-consuming parts of their job.
It's pretty amazing how it's being integrated. Imagine a doctor just having a normal conversation with their patient, but the AI is there in the background, grabbing all the important details, making a complete medical record.
I'm not going to lie, the first time I heard about AI handling medical notes, I was like, hold on, what now? Total sci-fi movie stuff. But the more you learn about it, it kind of makes sense.
Yeah, it all comes down to AI taking over the tasks that are honestly pretty boring for us humans. And in healthcare, that means doctors suddenly have way more time and energy to actually focus on their patients.
Instead of spending hours on paperwork, they could be using that time to really listen to patients, explain things clearly, explore all the options. Seems like a win-win.
Absolutely. And this is just the start. We're talking about streamlining all kinds of administrative tasks, maybe even changing how we diagnose and treat diseases entirely.
Okay, now you're speaking my language.
Uh-huh.
So let's ditch that doctor's office waiting room and dive into all the potential of generative AI in healthcare. Let's take a quick detour to the less glamorous side of healthcare. The paperwork. I feel like we've all been there, staring at those insurance forms, trying to decipher what our health plan actually covers.
Oh, absolutely. It's a huge pain point for patients and providers, really.
Right. It's like navigating a maze sometimes. But this is where generative AI could be huge.
Exactly. Imagine clear, easy to understand communication from everyone in healthcare, no matter how complicated your case is.
So instead of getting 5 different explanations from 5 different nurses or feeling like I need a medical degree to understand my own records.
Yeah. AI could streamline all of that, make it crystal clear for everyone.
And it's not just about making things less confusing for the patients, right? It can actually change how the software itself works. I was reading that Microsoft is already working on this.
That's right. They're looking at automating patient communication, making healthcare management smoother, even building AI assistants right into electronic health records.
Whoa, an AI assistant in my EHR. That sounds insanely helpful, but also kind of like something out of Star Trek.
A little bit, yeah. But think about it. You've got a question about a medication or when your next appointment is, instead of playing phone tag with the doctor's office.
Which, who has time for that? Seriously.
Right. You just ask your EHR. Gets you the answer right away, no stress.
Okay, that I can get behind. It seems like generative AI could impact so many parts of healthcare. But what about the really serious stuff? Diagnosing diseases, for example. Can it really handle that level of complexity?
That's where it gets really interesting. Generative AI has the potential to totally change how we deal with complex diseases.
All right, I'm listening.
Think about all the data we're talking about in healthcare. Medical records, lab results, imaging. It's a crazy amount of information. Way too much for a person to handle.
Tell me about it. I can barely keep up with my own medical history.
Exactly. But generative AI, that's what it's built for. It can analyze all that data incredibly fast and pick out patterns, insights that a human doctor might miss.
So it's like having a second opinion, but one that's read every medical textbook ever.
In a way, yeah. It's about augmenting human expertise, not replacing it. So we're talking earlier diagnoses, more personalized treatments, just better outcomes for everyone.
But this is all sounding very promising, but like any new tech, I imagine there are some concerns too.
Oh, definitely.
Yeah, I mean, it's exciting to think about, but also kind of unnerving. Like, we've all heard those stories, algorithms going rogue, causing chaos. How do we even make sure that doesn't happen, especially with something as important as, our health?
It's a huge concern, for sure. And you're right, the stakes are way higher in healthcare, which is why there have to be really, really solid testing processes, like before any of this AI gets used on actual patients.
So kind of like how new drugs have to go through all those clinical trials, years and years of testing.
Exactly. We need to be at least that careful with AI, making sure it's safe, it works the way it's supposed to, all of that, before it's in clinics and hospitals.
And who's in charge of all that? Like, is there some kind of AI police making sure these systems are up to code?
Well, that part's still being figured out, to be honest.
Yeah.
Right now, you've got different groups, like the FDA here in the U.S., who are working on rules for AI in healthcare.
So there are safeguards, but it's a work in progress.
Yeah, definitely evolving. And it's not just about the tech itself either. Doctors, nurses, everyone needs to be trained on how to actually use these tools the right way.
Makes sense. Even the smartest AI can't replace a good doctor, right?
Exactly. AI should be there to help, to give doctors more information, not to take over completely. It's about combining the best of both.
Sounds like we're on the edge of something really big with AI in healthcare. Exciting, a little scary, and definitely something we all need to pay attention to.
I couldn't agree more. The future of healthcare. It's not just about AI. It's about humans and AI working together. And if we do it right, it could mean a healthcare system that's more effective, more efficient, just better for everyone.
Beautifully said. This has been a fascinating deep dive into the world of AI in healthcare, and it's clear this technology has the potential to totally change how we think about health and medicine. But like we've been talking about, it's on all of us, patients, doctors, everyone, to make sure that change is a good one. So until next time, stay curious, keep asking those questions, and let's keep exploring the future of healthcare together.